driving that patient engagement from a FHIR perspective has helped and will help a lot more in the future.
You guys bring up an interesting point too, right? Thinking through the immediate and long-term value of FHIR. And I think you both touched on it, and I want to kind of ask a question back. Some of these payer groups right now, right, with the CMS regulations that come out in January, I think, oh, I can wait because they've already done some FHIR, right? They've already had some FHIR APIs they've had to implement in the past, but there are others now. And then you're hearing from data coming out of Bach and Gartner, they're like, oh, I can wait a little bit. It's not a rush. I've got time. But from what you guys are saying, there's value in making sure they're on the FHIR standard now. And it's not just something that is related to compliance regulations. It's really going to actually enable them to take another step forward to optimize not only a longitudinal care model approach, but predictive healthcare to empower patients, to educate patients, to improve health outcomes in the immediate sense, right? So it's beyond compliance right now. It's going to actually help them improve their overall program and the health of their member base, if I'm hearing this right.
I can agree 100% on that particular point. And a lot of it does come down to that value that FHIR adds from a interoperability perspective. One of the big things from a compliance perspective, but ties in very, very well to what we're talking about and what you just mentioned, is the patient access API that's come through from CMS, which is a FHIR-based process in which a patient can access all of the information that a health plan has on them. Now, we need to look at a lot of these things, and I really appreciate the way that CMS have done this, but also the way that they have approached it using FHIR so that it's an incremental process for the payers because it's using one standard across the board, right? When we saw things like meaningful use come in from ONC, the concept of it was great, but the data needed or the data structures used for like multiple areas of that were different. They weren't standardized. They weren't approached in the same way. And so if you were dealing with different organizations trying to meet that need, right, there wasn't really a straightforward path with which to do it. With FHIR, however, there is.